All right, so all it needs is power, plug it in, it's ready to go, okay? It has your baton. Okay, this is adult size. We also have one for babies as well, okay? This portion of it is very fragile, so I don't want to see it falling on the floor, okay? It will break, okay? This is its kind of case to protect it when it's not being used. That's what it should be put in at the end of the lab, and that way it protects it. If it did fall on the floor, at least it's protected. Okay. And that just fits in this little holder on the side. This is the blade, okay, that the baton will fit in. These are disposable, okay, but we're reusing them again over and over and over again, okay, because we're cheap. All right, if this cracks, just let one of us know, Erin or Janine, and she'll grab another one for you. Okay. Yeah, and they do crack, so don't be too concerned if it cracks on you. Okay. So that is the blade. So this is a 3, and the 3 is what fits best on all of the heads that we have. Okay. We do have 4s, and of course we have the baby size ones as well. Also on this stand will be a couple of stylets. Okay. These are just for the GlideScope. You can use them for the direct laryngoscopy if you want to, but they're primarily just for the GlideScope. Oh, one is longer than the other.
No, we shake.
Don't shake them.
Oh. Remember the corkscrew?
Oh my Lord. Okay, they're already shaped. It is the perfect shape. So don't try to shape them. Okay, don't bend them more because you don't need to. Okay, and plus it's very, very stiff. Okay, not like those malleable ones that we're using for direct laryngoscopy. All right, so please do not shape them. Okay, the size tube you're going to be using is either a 7 or a 7.5. Okay, those work the best in the intubation heads with the laryngoscope. Oh, sorry, with the GlideScope. Getting laryngoscope, GlideScope. All right. Just gonna take it out of there. Okay, so it just slides in and it locks into place. Okay, so. Now we're in. We're good to go. Okay? Turn it on, just hit the button and it turns on. Okay? This button here with the question mark, that's your tutorial. So you just hit that and it will play you a little video. Okay? And I think it's the same video that I posted in the lab as well. Any questions? It is the best thing to use for patients that are difficult airway, patients that are in C-spine precautions. They're just fabulous. So for preparation for an intubation with GlideScope, exactly the same prep as you would do for direct laryngoscopy. Okay, so you still need to set up your suction. Okay, and I've got it here, but it's not really hooked up to anything, but we'll pretend. Okay, so I've got my yonker ready to go. Got a bagger, should be hooked up to oxygen. Mask. Okay, what else do we need? Towel. Cheater. What else?
Endotracheal tube?
Yes. So I've got a size 7.5 here. It would be in its package. Okay.
The size up and the size down.
Yeah, absolutely. So this fits in here. You don't have to lube up the stylet for the GlideScope. They slide in and out pretty good. Okay. Don't jam it in really, really super tight, because what will end up happening is you'll pull out the stylet and the connector at the same time. So don't jam them in there. Okay. It will not come out the other end of the endotracheal tube because they are made that way, so they don't end up coming out the other side. Okay. Check your cuff on your endotracheal tube first, make sure it works. Okay, and we will. I already did that beforehand. You can trust me on that. Okay. Just gotta your tube, just the cuff. Okay. Gonna evacuate some more air out of it here. Okay, so if somebody's pre-oxygenating my patient, I'll have my tube and everything on the other side so that my assistant can hand me the endotracheal tube when we're ready to go. Okay. All right. And I just put this here on this side just so you can see it, see what's going on. So it'll be in slow-mo. So, 4 things to remember about GlideScope, or 4 ways to use it. First is, okay, you look in the mouth. That's the first thing you do is look in the mouth. Okay, so put the patient in head tilt chin lift. Open their airway, so you open their mouth, their oral pharynx, so you can see what's going on. Look in there. Do they need to be suctioned? Okay. And we'll say, nah, he looks pretty good. All right. The GlideScope, and what's different between the GlideScope and laryngoscope, laryngoscope is put in on the right-hand side of the mouth, and we're shoving the tongue over. Okay, GlideScope goes midline. So that's the biggest difference between your normal laryngoscope and your GlideScope. So it goes midline. So you're looking, so look in the mouth, and what you're looking for is for that tip to go past the base of the tongue. So you gotta watch it go past the base of the tongue. Okay, so that's the first thing you do. We're midline, it's gone past the tip of the tongue. Okay. Now you're gonna look at your monitor. So now look at monitor. Make sure you're midline, and get a view. Okay. So I've looked at my monitor, everything's looking groovy. I get my assistant to give me my endotracheal tube. Okay. I am nowhere near this guy's teeth. Okay, and that's a hell of a view. Right. When you're holding the endotracheal tube, hold it up near the end of the stylet. Okay, you'll find with direct laryngoscopy, you tend to hold it a lot lower. You're holding it down here, but for GlideScope, hold it up near the top. Okay, what you want to be able to do is get your thumb underneath the stylet so you can pop the stylet out. Okay. All right, so I'm not using a lot of force. My hand isn't shaking. Okay, you don't need to use a lot of force with this. All right, so my hand's up near the top. Okay, I've looked at, oh, hello. Okay, we've got a nice view. We're good. I'm gonna look in the mouth again. And the reason being is I wanna see where this is going. Because if you're not looking when you're inserting your endotracheal tube, you can actually be bashing the side of the oropharynx, perhaps causing damage, maybe causing some bleeding. So you wanna see where you're going with this. We usually come in from the side, so we might come in at a 45 or a 90-degree angle, and watch the tip go past the base of the tongue. Okay, same with the blade itself, just watch the tip go past the tongue. Okay, so I'm looking, I'm inserting it, it's gone past the base of the tongue. Now I can go back to my monitor again. So this is where it's really handy if you were a video game kid. I'm not. Okay, I'm not that generation. Okay, because your dexterity is really good, and your, you know, that fine movement is awesome. Me, no. But anyway, I'll make do.
That's which reflex.
Yeah. Okay, so you can see the cuff of the endotracheal tube. Yeah?
Yeah.
Everybody can see it? Okay. So now I'm looking back at my monitor again. I want to see the cuff go through the cords. Okay? If it's tough to get through, this is where you can what's called soften the tip. So you just pop your stylet up, and see that black mark? That should go down just past the cords. And that way you know you're in the right spot.
Can I come take a look? I don't know what you're talking about there.
Yeah, what's
Can
the
you see
black
it?
mark?
No, I can't see it at
Okay,
all.
come on up then. Come on up. See the black mark? Yeah, just take your time until you can do it smoothly. Okay, without a lot of force. Okay, So if you are having troubles visualizing, you've got it passed, and maybe the patient has a very small oropharynx and the blade's taking up the whole thing, okay, what you can do is actually go to the left, okay, and that will give you a view, especially if they have a very small mouth. Okay, so that's one way to do it. If you've got your tube in, God, I wish I had video games. If you've got your tube in and you are having troubles getting it to the cords or getting it through the cords again, soften the tip. Just make it part of the practice. It just makes it much easier to get that endotracheal tube through the cords. Okay. Okay, and again, you can remove this before you start manipulating your stylet.